your camera on, but it's fantastic to see your face. I want to welcome everyone that is here for the third monthly Community Touchpoint virtual session. My name is Jackie Collins. I'm the fund development director. I want to introduce this. The purpose of the Community Touchpoint virtual sessions is to begin to raise the profile of the incredible work that this organization does. Also, with the end game of engagement and making donors of all kinds and levels passionate about giving to MHAAC with an understanding of the faces behind and the energy and the passion and the mission of the work that is happening here. So what will happen today, it's about an hour. We usually go over maybe 5 to 10 minutes. I'm going to introduce my co-host, who is Miss Frances Joe. I will be, and then we're going to have a panel discussion after we have some other things that are happening. The purpose really is to highlight and combat stigma by humanizing the people that work in this field, hearing their voices, and then to hear and understand the actual work that they're doing and to fully contextualize it. So right now, okay, we still got people coming in. All right. If I have to pause, I'll let you all know. So I am going to introduce, I'm moderating, but our official host today is Frances Joe. Since I've been here, she is one of the most consistent powerhouses on our board. She is the board president. Frances Joe is a school psychologist. She's worked in San Jose, San Francisco, and Oakland school districts. She's had many, many years of counseling families and students and connecting them to community and school resources. She has served as the MHAAC on the MHAAC board of directors for 12 years. I'm now going to highlight Frances Joe, who will share sort of about her history and then why she's so passionate about the work that MHAAC does itself. So everyone, welcome Frances Joe, MHAAC board president.
Ooh, I apologize. I think there's something wrong with my background. If I try to fool around with it, I'm sure I'll lose you all. So I won't tell that. That's just how it is. As Jackie said, and I thank Jackie for putting this together, I was really fortunate to have many years experience. I'm a semi-retired school psychologist, and I've had many years in the mental health and education field combined. And I always felt it was such a privilege to be in a space where parents and teachers and students could tell me about their lives and share about it in a very transparent way. And I was able to help. I would try to help, to give resources, but most of all to just be a listening ear and saying, it's okay, it's part of life. We go through this stuff, you're not alone. And they really inspired me to walk the talk, because when I then I was a school psychologist all my career. So I started as a very young woman, but as life got harder and harder, I had many times where my mental health was really challenged. My mental well-being was challenged, and I had the privilege of having good friends and family that I can talk to. But it was also very important for me to find a therapist and to really deal with some of the things that was holding me back in my life. And so I am very passionate with the thought that our mental well-being is just as, if not more important than our physical well-being. So when I was retired, I was really happy to join the board of directors. We're a governing body. We don't get into the weeds and tell people on the staff what to do, but our job is to be sure that the infrastructure is strong so that the staff is happy and well cared for, and that our clients are happy and well cared for. I'm really very blessed to have had a life in mental health, in the mental health field, and being, in a place where we all understand we're all here to help each other. We're all in this together. And I'm grateful I can have this chance to introduce the staff members of the Family Education Resource Center, because they also walk the talk.
Thank you so much, Frances. I am going to now introduce our executive director, Miss Kathy Davies Huber. I'm going to paraphrase her bio. She's been the executive director and CEO since 2019. She's worked in leadership roles in nonprofit human services since 1987. Kathy has a master's degree in public affairs from the University of Massachusetts at Boston. Since she's joined Mental Health Association of Alameda County in 2009, she's increased revenue by more than 50%. She's increased staff salaries, and she's also modernized the agency practices and increased the agency stature within the Alameda County. The work that I do is completely aligned with her vision of increasing the agency stature, because that will ultimately help assure solvency for the work that you all are doing, which is incredibly critical, which is why we're all here. So I'd like to, no further ado, I'm going to highlight Kathy, who's going to talk about the mission and the purpose of the organization. And she will probably talk a little bit about FERC as well. Do I see you here, Kathy? Have I lost you? Oh yeah, there you are. I'm highlighting you spotlighting you right now. Everyone, our executive director.
Thank you for coming, everyone, today. Really happy to have you here. And yes, I'm just going to take a couple of quick minutes to talk a little bit about our vision and mission. And I also like to let people know that our vision and mission was created by our staff back in early 2020. We all got together when we could all still comfortably get together, although we are joining together again. But shortly before COVID, we had an agency-wide staff meeting, and people were asked to put up some statements about the values that they believed were most important to our work. And there were hundreds of statements. So then we narrowed it down. And out of that, we developed our agency's values of respect, integrity, accountability, and teamwork. From the remaining messaging or messages that were written all over these large pieces of sticky paper, I started writing our vision and our mission. And then it went out to the entire agency for review and editing, and then it went to the board for approval. So this was definitely an agency-wide effort, and one that I'm very proud of because it is reflective of all of us. It wasn't just written by me or by leadership or by the board. So our vision is that people with mental health challenges and their family members will be free from stigma and be provided the support and services they need to thrive. And then our mission is to empower adults and youth with mental health challenges and their families to live their best lives. We do this through education, support, advocacy, and shared experience. We provide client and family-driven services delivered by highly trained, compassionate, and committed staff who share the belief that recovery can and does occur. I think a lot of the important messages in those statements are, we don't want people to just get services or resources. We want people to thrive. We want people to be happy and healthy, and despite a mental health diagnosis, again, to live their best lives. And this is something that is really important to us. It's also really important that we share that hope with our own staff, many of whom have their own lived experience, and many of whom are testament to the fact that even with a mental health diagnosis, they can do extraordinary things. And anyways, we believe firmly and strongly in that, in our values and our mission and our vision. And I'm going to briefly now talk about FERC, but FERC staff are the best people to talk about the work that they do. But I will say, so again, I came to the agency in 2019, but FERC has been part of the Mental Health Association of Alameda County since 2009. And it was a group of local family members who got together and pitched the idea for FERC. And FERC is the only family resource center of its kind in California. So there are many family resource centers. Some serve children and families. Some serve people who are in need of a multitude of services and require one-stop shopping, whether it's for, issues related to income security or housing. But again, FERC is the only family resource center of its kind in the state that specifically works with family members who have a loved one with a mental health condition. So we're really proud of the work that we do. And I now turn it over back to Jackie.
Yeah. Thank you, Kathy. I could see you almost getting emotional, and I just want to say that from the time that I've been, it's really clear to me that how special MHAAC is. It's very special. I am now pinning our panelists as I segue. It's really clear to me how special this organization is and the impact that it has on the community. So we now have 4 FERC All-Stars that are pinned. I'm going to briefly read bios on everyone. We have Odessa Canton. Did I say that right, Odessa? Canton?
Peyton, yeah.
Caton. Odessa Caton, who is the director of FERC. And per Odessa's own words, her vision for FERC, for the FERC program, is that we are a collaborative agent of change for family members and their loved ones living with mental illness and addiction. Odessa envisions a world in which our human conditions are embraced and free from shame and judgment. Odessa sees her role from a support framework, supporting program staff, the agency, and our communities towards wellness. She joined the MHAAC staff in 2020. Kua Apara, did I say that right, Kua? Kua is, hold on one moment. Kua Apara is an Afro-Californian born in the San Francisco Bay Area with African roots stretching across the Mississippi Delta and bayous of Louisiana. Her Eastern Band Cherokee roots survived forced relocation to Oklahoma and the Trail of Tears. One moment, everybody. Here we go. Here we go. She is committed to using the ancient wisdom of cultural arts as a tool to enhance and advance mental health outcomes in marginalized communities. She received training in public health from UC Berkeley and also possesses a master's in biomedical science from the University of Northern California. I also edited this, but Kua is fluent in multiple languages, and it's absolutely incredible. Bianca Anderson is the Community Engagement Manager for the Family Education and FERC Resource Center, a program of MHAAC, and has been working with them for 1 year. Bianca utilizes her Master's of Arts and Communication Studies to foster community connectedness through mental well-being and effectively promotes FERC services throughout Alameda County. And last but absolutely not least is Mr. Jeremy Dantzler. Did I say that correct, Mr. Dantzler? Jeremy Dantzler is the program supervisor for the Family Education and Resource Center, also known as FERC, which is a program of MHAAC. We want to reiterate that, and has been on the team for just over a year. Jeremy received his degree in political science from the University of California, Davis. He considers himself a forever student who uses his passion and skills to advocate for all. Thank you all very much for being here. And before we start off, I want to acknowledge Odessa, who is the director and is absolutely extraordinary in her presence and her willingness. We want to give her flowers. And before we start our questions, just is there anything that you'd like to say, Odessa, before we kick this off about your team, about anything that's on your heart that I want to hold space for you?
Let's see. I will be very brief. Thank you all for coming, and I am honored to be part of working with MHAAC and for MHAAC, and I am deeply honored to have the amazing team that we have. And the work is very challenging because we are all family member caregivers, and many of us also live with our own mental health experiences and conditions. And So of course, there's strength in bringing and sharing our common experience with the families that we serve and the communities that we serve. And there's challenges too, because it's very intense. You know, we talk a lot about you go to work, you turn off work and you go home. Well, that doesn't really work the same way with us. So I just am in deepest admiration for all of us in the work. So that is
Hey.
my.
Well, I think Odessa, that leads off because one of our goals, it's a lot of what Bianca talked about when we met, passion about stigma, reducing stigma. So we're going to start off, and the way the questions will go, we're going to talk to you all as human beings working in mental health. Then we're going to talk about FERC, and then we want to get your viewpoint about specific parts of mental health, aspects of mental health at large. So starting with you, Jeremy, how did you end up working in the mental health field?
Thank you. Thank you for that question. Well, my mother has always worked in schools, and at one point she worked at one of my schools, and I remember that very vividly when I was in 5th grade. And so through my life, which I grew up very rough in East and West Oakland. I went to school in West Oakland, but lived in the East. I went through a lot, and through my trauma and through my PTSD, I started working with the youth at, when I went to high school. I started in volunteer programs and anti-bully programs, and then moved into getting in touch with like the law and different policies and stuff like that. And so very early, I was sort of attached to the idea of mental wealth. So here it brought me here today.
Amazing. I love that you said mental wealth. And Kua, how did you come into working in the mental health field?
Thank you for that question. Similar to Jeremy, I grew up in a beautiful home, an enriched home, but I also I grew up with a father who lived with substance use disorder. And that basically caused my mother and father to separate. And, just not really blaming my father, having a lot of resentment. I felt like he abandoned my twin sister and my mother and I. And it wasn't until I got to UC Berkeley and started studying public health, that was actually the first time that I learned to look at the disease of substance use disorder, to look at substance use disorder as a disease, right? And even though I grew up in AA meetings with my dad, you just take it for granted, right? And you don't really get how complex of a disease it is until you happen to hear a professor, someone who's more disconnected from you, stating like this is a disease and it deserves the same respect and honor and level of a treatment that we would give someone who's dealing with, any other type of disease that's not necessarily behavioral health related. So that's what got me into the field.
Thank you, Kua, for your vulnerability and transparency. Actually, both of you. We had our conference, and David Sheff, who wrote Beautiful Boy and was our keynote speaker, spoke so much of what you just said. So you are, again, mirroring a lot of principles that we're trying to transition, evolve. We still have people coming in. So Miss Bianca Anderson, how did you come into the mental health field?
Yeah, thank you for this question. And I really appreciate both of the responses that we've gotten already. So kind of similar, but promoting mental wellness and decreasing mental health stigma really drives my passion to work in this field. I'm a person who lives with multiple mental health conditions, and I'm also a family member to many loved ones with mental health conditions. So the work that's being done in our program is, to say the least, inspiring. Yeah, I'm really lucky that in this work I get the opportunity to be out in the communities and decreasing the stigma, because I was a person who came from a family and community where mental health conditions were simultaneously taboo and not talked about, but also people with mental health conditions were constantly villainized. And I saw people in my family get isolated and just basically like cast out of our family just due to mental health conditions, which was just incredibly scary for me as a young child who already knew that I was struggling with mental health. It really decreased my ability to reach out and talk to anybody because I had this incredible internalized guilt and shame that it was a choice that I was making and that I would be like abandoned essentially by my family if I were to come out about this. So being able to be in a place now where I've done, my mental health education, I've like gone on this wild mental health journey to come to a place and be able to work for an organization and specifically within FERC at this program to be able to help promote and stop this cycle of silencing and shaming and just really welcoming people with open arms and meeting them where they're at in their mental health journey to promote mental wellness.
Thank you, Bianca. And I just want you to know we're going to have space to hear more about that because you've expressed how combating stigma is a passion of yours, and I do have time for that. And then Odessa, how did you come into working in the mental health field?
Thank you for that question, Jackie. Well, I came into the mental health field, which is the field in which I've worked my whole career so far. I would say from my lived experience, and I'm a person who lives with a number of mental health illnesses. I experienced a childhood with caregivers who were struggling with untreated and unacknowledged mental illness and alcoholism. And so I just have this passion for connecting with people and having the conversations that, as Bianca said, are taboo across all of our cultures, honestly. And I'm a caregiver for loved ones living with mental health conditions like we all are at FERC. And I've also been a recipient of the ACBH Alameda County Behavioral Health Care Services and public assistance programs in my journey. And so it is deeply connecting to me to connect with others who have shared experience. So that fueled my passion. And what led me to get degrees is because I was pregnant with my beautiful baby with my partner, and I flipped out. Like, how do I raise a child? I wasn't raised well, so what do I do? So I turned to academia and learned all about child development because I just needed to be the best mom I could possibly be, so that my child and I could, actualize to our potentials. And I see that everywhere I look. People want the best for their loved ones, for themselves.
Yeah.
Caregivers tend to kind of forget about ourselves sometimes. And so it's really inspiring to me to be able to spread the word around self-care. We talk about it all the time. And to really have normalized conversations, open and honest about our mental illnesses and our addictions, and to step away from the shame game.
Okay. Thank you so much, Odessa. I love what you said, stepping away from the shame game. And I want to just highlight that all four of you shared really part of why I think FERC and just MHAAC is so powerful, coming about the work from a space of empathy and advocacy because of shared living experience that has created such empathy and advocacy that you all speak about. So I want to fully acknowledge that. So the next question for each of you, and we'll round robin, we'll start at Kua this time. So, how has the work that you're doing for other people in the mental health arena influenced you to intentionally take care of your own mental health? And what advice would you give to perhaps other mental health care workers that might be feeling burnt out?
Right. I think that we are really living in a time in US culture where mental health agencies are really picking up the slack from a broken medical infrastructure. And not only are we picking up the slack from a broken medical infrastructure, we also deal with less funding. So we advocate for funding on a national level, at a state level, which puts an additional burden on us as well to have to serve as lobbyists for our own cause, because Lord knows we don't have enough money to hire our own lobbyist, right? So it's a very taxing labor of love. It's something that we do this for the calling on our hearts. It's not something that we do for the pay or even the prestige, which we should have prestige, but even within the field of medicine, which is a highly prestigious field, psychiatrists are considered at the bottom of the totem pole. So we are still working in a cultural, societally, where we are, as Bianca has pointed out, overcoming stigma, not just at the individual and familial level, but at the systemic level. So for us as practitioners and providers and administrators, it's really important that we practice and model self-care. Not to put Kathy on the spot, but she openly talks about going to the gym, spending time with her family. And it's important to have leaders who model self-care and give us permission to take care of ourselves. In our staff meeting today, we talked about the importance of our family advocates taking care of themselves, having boundaries. So I would say that it's really something that has to be executed every day. There's a lot of unlearning. There's a lot of neglect that is kind of romanticized in our field, where it's like, well, if you're running yourself ragged, that means you're actually working really hard. No, you can work hard without running yourself ragged and working yourself until you're sick. So we want to model just like the slowing down, the being responsive, not being reactionary, being preventative instead of like waiting for us to have to always triage things. And we're constantly having those conversations with the clients that we serve. We really, really stress self-care. We hold outreach events in collaboration with our outreach manager Bianca and our FAs, where we're centering self-care for our clients and we're modeling it.
Great. Thank you so much, Kua. I think this is sort of this is the next plateau or the next level where mental health care workers, the stigma is destigmatized by first understanding the people that actually do it. And I hope you all can see with the questions that I'm asking, that is the whole point of Community TouchPoint, to really show your humanity and then connect it to the work that you're doing, and then connect it to the community, and then get some more funding, because people need to understand the depth of it. I'm just gonna, because we don't have that much time, I do want to segue now. Thank you. But before I segue, did either any of the people who didn't have a passionate answer that they wanted to share before I jump to more questions? Or are you okay? Did anyone have something they really wanted to communicate? Bianca, go ahead.
I
Go for
feel
it.
like Kulwa did a beautiful job
Yeah.
explaining and answering those questions. So honestly, unless Jeremy, you have something to add, Kulwa, you did stellar.
Okay, awesome. I do want to ask you, Odessa, if you could just be very brief, what advice would you give to, because you're a director, you're working with staff, what advice would you give to a mental care worker or supervisor that's managing staff that may not be burnt out, that may not have a leader like Kathy, who, just from me working with her, is always like checking in and advocating, taking time off or whatever is needed. I've experienced that from her. What would you say, Odessa? Just really briefly, I do want to hear your viewpoint on that.
So I think for me, it's very important to be able to create a safe space in which our staff can be their authentic selves. And I really truly look at everyone from the perspective of our voice is important. And if we don't give voice to our needs, our perspectives, we're going to suffer.
Mm, yeah.
And so I think that within our team, we are continually creating and building and strengthening our safe shared space as a team. And then also I'm hopeful that I'm supporting supervise everyone here in the screen to be able to create that. And I know that you do for the staff that you support because staff need that safe haven.
Right.
And we talk about self-care all the time, which is one of our strengths.
Mm,
And we value people voicing their needs. And like Kula, you said, setting boundaries, practicing self-care, and then also leaning into our own communities for support when we're struggling with burnout and that kind of thing. So.
excellent. And I do want to mention, Kathy, I don't mean to put you on the spot, but there is MHAAC, and the last thing I want to say, MHAAC is very much walking the walk and not just talking the talk, walking the walk, because my understanding, Kathy, is that there's unlimited mental health something. Can you just share whatever that is, Kathy? I just realized that.
Sure. So our agency has traditionally had Kaiser for our healthcare, and we've had a very rich plan, 100% paid for employees. And we surveyed our staff a couple years ago because we were like, well, but Kaiser doesn't have the best reputation for mental health, and we're a mental health agency. So our staff at that time overwhelmingly wanted to stay with Kaiser, many of whom have been with Kaiser since they started working here 20 plus years ago. So I started asking our insurance broker, was there any sort of standalone mental health plan? They couldn't find one. And one day I was at a meeting and new benefits presented on their unlimited telehealth mental health services. I would say it's not perfect, but it is available and it is
Right.
100% free for our employees. And it's also different. You know, if you're somebody who's been in therapy off and on throughout your adult life, yes, and you're used to sitting in a room with somebody for therapy, and then you try telehealth, it's different. I tried it. And it's also one of the reasons that, you know, my position about teleworking has been some of our work is done better in person. And so we
Okay.
need to be prepared to meet our clients where they are and if they'd like to see us in person. So anyways, I know I kind of rambled off.
Yes, okay.
Anyways,
Yeah.
it is available for our employees, unlimited telehealth therapy for free.
Yeah, and so thank you, Kathy, and Ethan, our HR person, so that, you know, zero copay. And I just wanted to give voice to that because MHAAC is rooted in lived experience, and MHAAC has a structure to support the emotional well-being because we have a staff that's rooted in lived history, and it's very intentional, which I think is again why the organization is so special. So thank you all for your transparency. I think that is a big part of destigmatizing and humanizing the mental health journey from different aspects. We're a little bit pressed for time, so I'm just going to ask Kua to just give me very briefly an overview of what FERC does and your and what you do as the assistant director. And then I want to give everyone a chance to really speak to that, Jeremy and Bianca, because Odessa, we know what you do, which is support, and it's amazing. So really briefly, Kua, because we've got to make sure we have space for everyone. Thank you, Kua.
Okay, I'll be very brief. We kind of touched on it already, but we were founded in 2009, FERC, Family Education and Resource Center. We are a department within MHAAC, right? And we were founded by peers. We were founded by people, individuals, community members who take care of a loved one living with mental a mental illness or a mental health condition. And we basically provide support to family members who are supporting their loved one living with mental health issues. And we support them in navigating a very complex and broken system that can be very dehumanizing at times. And sometimes it's great, right? So, but we navigate our clients through all of the hills and valleys of it all. And as assistant director, my role is to primarily support our leader, Odessa, who is amazing. And she leads with just an extraordinary grace and a sense of just radical purpose of us, like really just, leaving no stone unturned. So, I mean, what I do kind of varies from week to week, but I'm really just to support the vision, the mission, the overall mission of FERC and support our family advocates.
Thank you, Kua. And Jeremy, I'm going to jump over to you, and if you can talk a little bit about what you do, but with an emphasis on FERC's relationships with local families and how we're at day to day, what that relationship is like, and how FERC is really fulfilling a need within the community.
Thank you for that. The first word that comes to mind is access. We want our community members and our family members to have access to us, to have access to the resources that are legally allotted to them. This is really important when it comes to individual education plans, conservatorships, sometimes housing, legal evictions, domestic situations. There's a lot going on that we aid our clients with, and sometimes even going to their court cases and standing right beside them as the judge goes through the rigmarole, right? As we say sometimes. And we support them through that, filling out paperwork and all that, making sure when they send in documents to the courthouse or to the Department of Education, it's up to snuff and it's clear. So that's sort of that. And then on a broader scale, as an organization, we want to be there for the community to come speak about different events that happen in the community, mental health stigma, like Bianca said, community policing, as we recently had, and also how to navigate through the Alameda County behavioral health system. That's really important. So we just want to have access. We want our family members in our local community to have access to us and to those resources.
Okay, and so Bianca, I know that you're doing comms, but you're also doing events, and so you're interacting with families, is that correct? And you're talking to them?
Yes, oftentimes it is resource fairs or events that are out in the community. So it's a lot of meeting potential clients who are going to be calling. And then at the events that we do host, then I do get to meet clients that are already active clients.
And so what do you and Jeremy sort of feel like is the most pressing needs for our Bay Area families within the scope of mental health?
Wow. Yeah, that is a tough question, but I would
take a deep breath and take your time with that, Bianca.
Yeah, I mean, I would say most of us touched on substance use disorder. That is a very large concern in our community right now, especially because it's not considered by all as being a mental health condition or a mental health concern, which is just not correct. So definitely with substance use disorder, that is very prevalent within our community, along with the co-occurring disorders alongside substance use. And the overwhelming amount of people that I talk to are just, they need that basic level of education, of mental health education, of like, what is this diagnosis? Like, my sister was just diagnosed with this. Like, what does that even mean? Because a lot of the mental health education that people get is just from, the mass news media, which is highly inaccurate, very stigmatizing, and just not inclusive and not accurate. So those I think are my two big ones. Jeremy, if you want to add on to that.
I'm actually going to say, Jeremy, if you don't have anything to add on, I wanted to ask you if there's anything that you want to add, but just how do you all as a group? I know there's some people that maybe should have been a part of this that are also client interfacing. I know you all are too, and we're going to do these again. But if if there's something you want to add, go for it, Jeremy. But I also want to ask you about how do you all really encourage encourage a family that comes to you overwhelmed and really disempowered, because like I said when I was doing our prep, there's a mystery can be very disempowering, and you all are handling and confronting mystery that is systemic, that is intentional. How do you help manage that, Jeremy, when someone just comes and they're just at their wits' end about their child or someone else in the family?
That's a great question. I think to add on and also answer this question is the education piece that Bianca spoke on. Education is power, and you don't have to have a lot of money, but you have to have a lot of education. And something that Kua always tells me now is you got to be organized, right? And so we also bring structure to our families, because things are, it is like a tornado, especially if they just went through a 5150 and it just happened, and now they got to figure out they're picking up the pieces, right? So we're there to help pick up the pieces with them, and so we help reorganize that kind of space for them, not physically, but sort of mentally, and give them some education on what they can do next. Once we do that, we always set a goal. And then a goal that is attainable, and a goal that we can check on, a goal that we can potentially measure, right? So that we can leave them with something when they come to us, along with the emotional support, of course. But we want to leave them with something when we're done with that conversation. And typically it's going to be a goal and some education to go along with that.
I think what you said, Jeremy, is incredible, bringing structure to the families, because again, I don't think people understand how destabilizing it is when this is coming up and you have no data, you have no support system, you're trying to work a job, you're trying to do all of these things. And I think that's a good segue, because we talked about some passion points that we've sort of touched on, but I want to make sure we hold space for all of you to talk about passion points about mental health at large that you're seeing through the work that you're doing. And so, Kua, if you could speak briefly about your perspective on the impact of mental health on housing and crime, and a solution, as well, and how FERC can help that. And then we'll go to you, Jeremy, about racial trauma and racial inequity, and then stigma. And then we'll let your wonderful leader, Odessa, close this out.
Thank you, Jackie. I think that the impact of crime and the lack of housing, or the constructed, rather, an intentional lack of housing so that the market can stay highly competitive, it is having a very severe impact on our mental health tapestry. I think that especially when we live in a society that has been intentionally created to marginalize low-income folks and POC folks into certain communities, which goes back, way before any of us were even born, like quote unquote racial covenants in housing and redlining. And so who is exposed to certain areas where there's a higher violence level, et cetera, what we're noticing is that the health outcomes in these communities are going to be much more bleak, right? So Oakland, the city of Oakland, has the lowest mental health outcome indicators than anywhere in Alameda County. And then the flatlands of Oakland in particular have, people are living 10 years less than people in the Oakland Hills. And so we just had a person from Oakland Police Department come and speak to our community members about how we can stay safer in Oakland because the increase in crime definitely enhances our risk of anxiety, of PTSD, of depression, and things like that. So I think it's a very important topic, and how we are specifically helping within FERC is serving as liaisons to connect our family members, the family members that we serve, with resources. We help our family members, whether they need support advocating with the housing authority or they need support connecting with 211 for, rent support, et cetera, et cetera. The list goes on. We do whatever we have to do to help keep people housed.
Excellent. Thank you, Kua. And I think this is a great segue to Jeremy and your viewpoint about racial trauma, but which is coming from systematic racial barriers within mental health. And I want to give you time to speak on that as affecting mental health in Oakland, but as overall as well.
Thank you. I think racial inequality is real, not only on a systemic level, but on a social level, and how it's dealt with in the mental health field is atrocious, in my opinion, sometimes. There are too many examples of mental health conditions and mental health episodes that aren't recognized for Black and brown folks, specifically Black folks, and how we're dealt with when we cannot be adequately diagnosed or respected as having an episode is we don't even need to get into that conversation, right? And so
Yeah.
I find that hard, even from my day to day. And then on top of that, the perpetual demonization or the perpetual stigma that the media plays and keeping some of this stuff alive keeps us from solutions, right? Keeps us from actual discussions that Black folks really want and that we really have, and we've discussed in our own communities. But of course, the media or the powers that be, they don't want to hear those solutions, so that's how I feel on that.
Thank you, Jeremy. And I just want to say, we can have that discussion. We just don't have time today. But the reality, and that's what this is for. The reality is that Black and brown folks are treated much harshly. We're disciplined, whether it's through the police or it's in an office or it's at a school, graduate school, grammar school. We are always disciplined much harsher. It is an ingrained unconscious bias that has cut across our wellness and quality of life. We don't have time and space to talk about it now, but it affects our mental health. I'm sure we've all experienced that. So I just want to tell you, Jeremy, we do want to talk about it. And that perhaps is another community touch point event that is important. And we do want to talk about it. Bianca, I'd like to go to you. You're very passionate about stigma, combating stigma. You talked about it from a lived experience. I just wanted at the beginning, but I want to give you time to really address that now.
Yeah, thank you, Jackie. I appreciate this. Yeah, like I was saying, I mean, my mental health journey and experiencing that stigma and shame firsthand really informed the way that I approach mental health today. And then realizing that my struggles, although that they were severe and felt highly personal, they were not unique to me. And that was so important for other people to know. And at the time in my circle, it became just basically me talking to them about their mental health and trying to figure out ways that we can help them and then help me. And it was just a lot of this like mental health research that was so frantic. If that stigma wasn't there, this research and education wouldn't be so untouched or like seeming like you have to do it only when crisis is striking. Like this preventative aspect is so important because we need to be proactive about our mental health. And let's see, I know I had another point that I really wanted to get to on this. With being able to, like my work being out in the community, it's really all about being able to meet people where they are at. if I'm trying to do mental health advocacy, mental health education out in a community that doesn't have the same level of education on mental health that I do, what help is that going to be? None. If I'm able to reach people where they are at, and I've got all the experience based off of my upbringing of speaking with people who don't think about mental health except for using terms that we don't use in the mental health field. If I can speak to those people about mental health, like I've done with my father, was able to speak with him about mental health, and like we're scheduling him a therapy appointment tomorrow. I can speak with anybody about mental health in a way that they can connect to it, in a way that they're willing to look at and see in that moment. And then we can go from there, and things can only go up from there. So yeah, it's just so important to be able to speak directly with people, and from a human level, and from that really place of deep understanding that, yeah, it helps us all overcome and helps our community heal.
Yeah, thank you, Bianca. What I've heard from the three of you really is the transformative power of transcending shame through your lived experience and then empowering other people. Every time I do these events and we talk to MHAAC staff, that is my biggest takeaway of the power of embracing your own healing and then taking that on a larger scale. I'm about to tear up. I'm blown away by all three of you, and all four of you, I mean. It's just incredible. I was tearing up at the last one with family partnership, how you take what may be such a challenge and then it's transformed. It's amazing. Odessa, I'd love for you to, and Ethan, our HR person, is, yes, indeed. It's really the incredible work that this organization does. Odessa, we're at really good time. I'm giving you a minute to close out with any last thoughts or whatever you'd like to share. And then we've got a little bit more in our presentation. Go for it, Odessa.
Okay. So the panelists have expressed so thoroughly where our passion lies, what drives the work, and our mission and vision and values. And it's all about relationships. That's all I wanted to end with, is that in order for us to access ourselves, access those around us, our communities, it's all about relationship development and respect and compassion. And so that's why it's very important for us to be able to connect with others across this commonality. So that's my my final thing. I think that we as a program deeply honor the intersectionality, I have a hard time with that word, the intersectionality within diversity. And we approach through curiosity, which is so key. And we are champions for embracing the mental wellness and mental illness milieu within the physical health milieu, right? So that if we could all have conversations about our mental health, just like we talk about, I broke my toe, it would be a very different world. And I know that we are going to see that day. That's what I think.
Yeah, that's amazing. I want to acknowledge Kathy, our ED, just left. It's like if we could talk about it like we talk about the Bulls or the Warriors or something. Absolutely. I am going to, my heart is all of you. I don't even want to unpin you all, but I think that this is a reflection of deeper communication and talks that we need to be doing within our organization, but just overall. I am removing the spotlight and then I'm actually going to screen share. I want to make sure everyone is aware of how to reach FERC, and I want to go over this slide with everyone. Can we all see this slide here? Okay, so FERC has a warm line. They have a main line. You can also email them at askFERC at MHAAC.org. There's a main Oakland office, 7677 Oakport Street, Suite 100, Oakland, California. There are 2 suites located inside the Fremont Family Resource Center, which is at 39155 Liberty Street, Suite D. Okay, someone in the waiting room. Hi, welcome. Suite. So there's 2 suites located inside the Fremont Family Resource Center, 39155 Liberty Street, Suite D 400, Suite F 600. FERC has a really great website, and FERC has, can everyone see the FERC website here? Are you all seeing the FERC website?
No,
Yeah.
no,
Okay,
it didn't switch.
okay, hold on one second. One second, everybody. This is the FERC website here. Is everyone seeing this here?
Yes.
All right. And
Yeah.
now, so there's the FERC website, which is FERC.org. This is FERC's really snazzy Instagram. Can we see this one?
Yes.
Okay. So I love this one because I think Bianca and I are always messaging each other here and don't realize it when we're posting stuff. I'm posting stuff from MHAAC. She's posting here. We have so much fun. So this has a lot of the events, not just FERC posts what they're doing, but they post what other programs are doing as well. So this is a great resource as well. And I think, let me just hop back to our Canva. Okay, so, and then there's also the Facebook, which has stuff. FERC will attend events. They will do workshops for people in the community. And I want to give Miss Bianca a quick moment to talk about that briefly. Bianca, what FERC can do within the community.
Yes, amazing. So we love coming to people and giving workshops. We've done this with a department at a unified school district. I know that Kula just led one with a group. Let's see who was. It was the apartments on suicide awareness and prevention. So we love being able to go out into the community and do workshops and being able to educate folks on whatever it is that you need help with. So whether that is coming from an educational standpoint, it's coming from, a parental standpoint, whatever the case may be, we are ready and willing to create and tailor workshops that are going to help benefit you. And we love to table at different community events and resource fairs. So if you ever are having a resource fair and you would like to see FERC and our beautiful staff and all of our wonderful resources there, please reach out to me and let me know. Otherwise, I might end up finding you anyways.
Thank you so much, Bianca. And so that's how we reach FERC. I do want to let you all know that we do have a Give Butter fundraiser happening. I'm going to put that into the link. Are you all able to see that? Are you seeing our Give Butter fundraiser?
Yes.
So we've raised $880. So if you can share this on your socials, that would be great. I'm going to put that in there. And then what I'd like to do before we close out, I wanted to make sure, did anyone have any questions for our panelists? We're moving really quickly and they are just amazing beings. And while we have them, I'm going to re-spotlight them. And then I'm going to see if anyone has any questions. Please raise your hand because we kind of skipped that because I'm worried about time, but we're okay. Did anyone have any questions? It's okay if there are no questions. Okay. All right. So this is our incredible FERC staff. I am going to pass it to I'm going to keep you all highlighted just because why not? There's no questions. I am going to ask Miss Frances Joe, or actually, Miss Frances Joe, did you have anything you wanted to say last words before I thank everyone?
Well, I thank you first, Jackie, for pulling this together and being such a great MC for all this. It's always a good time. I always appreciate the time to thank our executive director, Jackie, the staff. Basically, you all responded to the calling of your passion. And because you do that, you're genuine and you make a difference, and it is so much appreciated. There's so much work, there's so many obstacles, and I think together it's great that we can continue to accompany each other as we help our clients and as we help ourselves. And I'm going to start using Jeremy's phrase, as we accompany our clients and ourselves to acquire mental wealth. So
Beautiful.
thank you. Thank you all.
Beautiful. And I just wanted to say that my takeaway from this was the humanity of all of you. I think that this is the work. I think that there are other deeper conversations about what you're talking about, Jeremy, that must happen so that it all is honest for what it is. What you talked about, Kua, and what you talked about, Bianca. I'm every time we have one of these, I'm just blown away. So thank you. The work that you're all doing. Adriana said, thank you for your powerful work. It's critical that we join together to fight the stigma, because that ultimately will lead to the healing. I think people don't realize that systematic racism, injustice within the healthcare system, yeah, Black and brown folks are dying, but it impacts every other race that thinks they might be benefiting from it. The dehumanization of me is someone else's dehumanization. And I applaud all of you. You're walking the walk, and you're not talking the talk, you're walking the walk. I'm going to invite each one of you back. Thank you. And I want to honor every one of you and give you 30 seconds if there is a final last statement from either of you, because this space was for you all, which is inclusive of the work that you do. Any last statements from anyone here?
I just want to thank everybody for coming. And the real thing I want to leave you with is talk to your neighbors, talk to your friends and family, really speak about what's going on, really speak about elevating the conversation of stigma and mental health. Just continue to elevate the conversation no matter where you're at. Throw that conversation in there, right? It's never a bad idea to just have a quick little chat about your mental health, everyone's mental health. And I think it'll go a long way if we all can do that.
Thank you so much. Kua, did you have a closing statement?
No, just thank you all for being here. Thank you, Jackie, for your vision. It's an honor and a privilege.
Miss Kua. Miss Bianca, closing words.
Yeah, I just want to thank everybody and echo Jeremy's statement, because it was very beautiful and very powerful. And thank you to Jackie and to Francis and to Kathy and everybody else who is attending here today, for listening to us and interested in learning more about our program and the work that MHAAC is doing, because it is incredibly important.
Yeah, it is. And last but not least, the wonderful leader, Odessa, final words.
Thank you everybody for coming and joining us in this. It's a collaboration on all levels. And so I know that we all four feel very privileged that you've come to join with us and listen to us and to join in the work. And I know many of you are in the work. So we're grateful for you, and always eager to partner and collaborate. And thank you, Francis, for your leadership, and Kathy, who has gone, and Jackie, thank you so much for this. This was wonderful to be able to see and speak with everyone.
Absolutely. This is what it's going to take to guarantee more solvency. Thank you, everyone. Have a fantastic weekend. You are extraordinary human beings doing extraordinary work. Bye-bye, everybody. Thank you to all our guests as well. Bye-bye, everyone. Francis, can you stay on for a hot second?
Yes.
Okay, while everyone else leaves. Bye, Bianca. We can
Bye,
stop.
Kara. Bye, Greg. Bye, Lois. Bye, Helen.